I'm sure that we all had better things to do, but that Mr. Oxendine is willing to give up his time to share his own experience about health careers. Mr. Oxendine's been a leader in health education, health executive, and an author for 35 years. That means he started when he was 4.
Mm-hmm.
He has been a leader in health workforce diversity. He's been the CEO and the founder of Health Career Connections, which I'm sure he'll talk about. And their application deadline is when?
December
December
5th, coming
5th.
up.
And he did a presentation about a month ago about that as well. And we'll send out a couple of email reminders. He has been a health executive, and he's also been the dean of uh, public health practice at UC Berkeley for many years, and he's still faculty there. He was also the co-faculty director of undergraduate public health major. And a rumor that I heard is you're the one who actually started that. So
I was part of it. I
he
was
was
part
part
of
of the
it.
team that started that,
Yeah.
and so he's been a leader at UC Berkeley School of Public Health for years, and he's held numerous positions um, he's also held position and taught at Harvard School of Public Health, and he's also led many committees on health diversity and health workforce statewide and nationally. So, without further ado, I'm pleasure to again introduce Mr. Oxendine, who's joined us again, and someone that I actually consider a friend. So
Absolutely. Thank you, Jubin. And yeah, I was going to say the one thing you didn't list is that I'm a fan of Jubin and the incredible work he's been doing for so many years to empower all of you to choose the health career you want and to be successful. So that's what we're going to talk about today is we're going to continue our dialogue on how do you choose the health career that best suits you, whether that be a doctor or other health careers. Today, the topic was really about what are other health careers that you can consider. I know many of you want to be a doctor according to the survey, and that's terrific. And if that's the case, if that's your authentic health career, we really need you. And we will support you to become the doctor that you want it to be. And so know that this talk is not to dissuade anyone from being a doctor. It's to help you make a well-informed choice, because not only have you thought about medicine as a career path, but you've done your homework and looking at what are all the other hot and emerging health careers that are out there, and really made sure you understand your why you're pursuing those careers and how it aligns with the life and the career and the impact that you want to have. So you can be a doctor, but you don't have to be a doctor. And we're going to really just talk about what are the other health career options out there in addition to being a doctor and in combination with being a doctor. How do you choose? And then we're going to get real specific about internships that you can pursue, jobs you can pursue, those kinds of things. And the people on the screen here are people who are living their authentic health career. These are Health Career Connection alumni. I actually saw a couple of them in Boston a couple of days ago. This is in New York a few years back. And these are people there in this picture, are doctors, are consultants, are nurses, are public health leaders. They're living their authentic health career. That's why they're smiling. And so my goal is for you to be smiling, standing next to me too, living your authentic health career. So let's get going. So we're going to talk about today, in order to choose the right health career, you need to know which are the hot and emerging health careers. What are they? And then you need to think about, how do I align with those options? I'm glad to hear some of you are interested in public health. I'm going to make sure you get a little bit of exposure to public health. Public health used to be a well-kept secret before the pandemic. Obviously, it's not now. You can see that public health is really important to everyone all the time, and that encouraging you to either consider public health as a path in itself, or in combination with being a doctor, with being a nurse practitioner or a PA or a social worker or a behavioral health person, whatever you want to be. They are great. They go really well together, and we'll talk about that. Talk about how to pick. We're going to give you a little exercise on beginning to define your health career direction more clearly, and then we're going to talk about specifics, what you can do. So to get the ball rolling, I know you already completed your survey, but if you could just put in the chat briefly your school, your major, and what year you're in, whether that's high school or college, or if you've graduated. I'd like to know one health issue that you're passionate about, because in order to choose your authentic health career, you got to tap into that passion, and you want to be able to put it into practice. I'd love to know what health professions you're considering. I know many of you already put that in the chat, but I encourage people to pursue 1 to 3 directions, health professions. So you can be thinking about a doctor and a nurse practitioner and a public health professional, or you can just be thinking about being a psychiatrist. Whatever it is, put it down. And then I want you to think about what would make your health career choice rewarding for you. Is it about taking care of sick people? Is it about seeing patients? Is it about making a certain amount of money, serving your community, giving back, fulfilling your spiritual goals? I'd like to know, like, what is going to, when you are successful in your health career, which you will be, what is it that's going to make it rewarding for you? So go ahead and just take a couple minutes here. Let me see who's out there. All right, college Cynthia, that's great. Love college track. We actually have a internship program for Health Career Connection where we support college track students. So I'd love to be able to connect with you about that. All right, let's see who else is out there. I know you came, it's Saturday morning, just getting up. You didn't want to have to think so much, but this is your health career. This is about you. So thank you, Eduardo. That's great. I love the combination of business and nutrition. That's an excellent conversation. All right, Bakersfield, Jose. Excellent. A UCLA grad. Go Bruins. That's cool. Yeah, definitely need your Spanish skills. Go Deanza. Excellent. PA. Epidemiology. All right. I love the combination that you see. I'm glad you're deciding between public health, medicine. You can combine them as well. It's great seeing who's in the room, and ID for adult. All right, excellent. UCSB, love women's health here, more important than ever. All right, well, it's great to see who's here. That helps me to tailor my comments, and please continue to put things in the chat so I can learn more about you and see what questions you have. So now let's dive in. I do want to know, like, what questions that you have. Are there any burning questions that you want to make sure that we address today? Just so I can begin tailoring my presentation, as Jubin said, to what you're interested in. Put them in the Q&A instead of the chat. That's great. Any particular questions you really want to make sure we address? It's okay if you have them or if you don't have them. All right, epidemiology. That's great. I will not be giving an epidemiology lecture, but I can talk a little bit about what epidemiology means. It's a great field.
Somebody wanted to know about pharmacy.
Okay, that's great. Other questions? Definitely gonna talk about internship opportunities. Difference in the clinical day between a DOPA and NP. I can talk a little bit about that. I'm not a clinical person myself, but I've been in the field for 40 years now, and I've worked with all kinds of different providers. Okay, well, this is great. I will come back to these as we go along if we do not address them. Thank you for sharing. Well, I want to start out by saying good job for being here on a Saturday morning. And please know that it's more important than ever that you achieve your authentic health career, and that we build the pipeline of people who are from our communities, who reflect the population, who have the lived experience, the language skills, like the person who said they want to use their Spanish skills. It's more important than ever, given the impact of the pandemic, given we have a large number of people in the health workforce that are retiring, they're baby boomers or they're burnt out, and that we really need you, we really want you, and you really do belong, in the field. Sometimes I say this because sometimes in the health field, we feel like we don't belong, particularly if we're not from one of the backgrounds that's most the mainstream backgrounds in health, and health kind of, and the whole education process, including taking organic chemistry and study labs with certain, other folks. Sometimes you feel like you don't belong, and counselors might tell you that you can't do it, which is BS. So you don't have to listen to them. Just know that you belong in the field. It's a question of figuring out where you belong and how you can have the most impact. And so please go forward. And that's what we're going to talk today about, how you can do that. So to start with, I want to tell you about, if you're going to know which health career to pursue, you got to know it's possible. And I was the co-director of the California Future Health Workforce Commission, which was a statewide commission in California that for 3 years had some of the top leaders in the state that met and talked about what are the health careers that are going to be in the highest demand and the most important ones for meeting the health needs of California, and also the most important ones for people to pursue as a career path between 2020 and 2030 was the time horizon we were looking at. And so of all the different health career options that are out there, and there are hundreds of health careers, the ones that the commission felt were the most important to focus on are primary care and prevention including public health and other forms of prevention, behavioral health, which includes substance use, taking care of people with substance use issues. I'm a Native American from the Lumbee Indian tribe of North Carolina, and our biggest issues are substance abuse, prescription drug abuse, those kinds of things, opioids, and depression, anxiety. So substance use and mental health are behavioral health. And then healthy aging and care for older adults. We have a silver tsunami taking place in our state where the people over 65 are going to double in the next 10 years, and the people over 85 are going to triple in the next 10 years. And so a lot of older people, and a lot of times people like you who are coming into the field don't always think about serving the elderly population. So I'm going to encourage you to think about that as you go forward. It doesn't have to be in a nursing home, kind of a situation. It could be in helping people have healthy lifestyles and make healthy choices and remain active and live in their homes and age in place. It can be helping people in the hospital, be helping people at the end of their life. So encouraging you to think about that, because there's a huge need for people in that area. Obviously, across all the professions that we have, if we're going to improve the health of our population, we need to increase the diversity of the workforce. That's where many of you come in. We need to increase equity within the workforce in our communities, and we need to be able to leverage technology, which many of you may be really interested in, to really leverage technology. We're not going to be able to have enough people to meet the health needs of our population, nor could we afford it if we did. So I'm encouraging some of you to really think about how can we use technology in a more effective way and large scale way, things like telehealth, telemental health, digital health that can really have an impact. So these are the things that the leaders in California health are really focusing on. And so within those, here are what we identified as the hot and emerging clinical career paths. And these are clinical paths, which many of you seem most interested in. And hot and emerging means that there's a need for them now, that the demand is projected to increase in the next 10 to 15 years, and that they're going to play an increasingly large role in health during that time, on the health of the population. So there are, as you can see, primary care physicians. So those of you who want to be doctors, physicians are still really critically in need. Primary care physicians, psychiatrists are two of the highest demand areas that we need. Also, general surgeons, gastroenterologists, a number of other types of physicians are going to be needed as well. But you don't have to be a doctor. Advanced practice nurses, which are clinical nurse specialists, nurse practitioners, nurse midwives, are in high demand. And in California, there's a lot that's being invested in nurse practitioners to be able to have more training programs to produce more nurse practitioners, have more incentives for nurse practitioners to work in underserved communities, to work in primary care, to work in behavioral health. And we've given nurse practitioners more practice authority to operate on their own. So nurse practitioners of the future are going to be able to operate their own practices. And many nurse practitioners are operating practices in underserved areas, rural and urban areas. And so many of you may want to be able to to do that. There's certain things that nurse practitioners can't do that doctors can do. Doctors have more training, a lot more years of training, and more practical residencies and those kind of things. But there's going to be more and more roles and needs for advanced practice nurses. And hopefully some of you will consider that as part of your path. Physician assistants are also increasing. I know in the chat, in the Q&A, folks are trying to decide, do I want to be a physician? Do I want to be a nurse practitioner? Do I want to be a PA? PAs, I think, will also be getting more practice responsibility. I know that more folks are looking at PA school now because it's a shorter period of time, and they can get great training. They can have good patient care and autonomy, although they are under supervision of a physician, and they can spend more time with patients. And sometimes they can work a little bit more on upstream things. They can work in primary care, but a lot of PAs also work in specialties like orthopedics or OBGYN, areas like that. Some are surgical PAs. So, I think for those of you trying to decide between PA, nursing, and being a physician, you want to be able to think about, how much capacity do you have to go through the training process that's involved, and how much do you want to get that in the in-depth training? How much do you want to have autonomy in your practice? How do you want to relate to patients and relate to other people in the field? And how can you have the lifestyle that you want to have and the income that you want to have? And being able to, I would do informational interviews with PAs and with nurse practitioners and physicians. I would do, obviously, when you can, do clinical shadowing, clinical internships, or other kind of internships. I would go and talk to the admissions people at these different schools. Think of alumni from your schools who are in those roles, and being able to talk with them about what they do and what they like and what they don't like. What's a day in the life like? It's different for all of those, and it's different depending on the settings. Sometimes physicians are seeing more people in a shorter amount of time, more focused on quickly diagnosing what they've got, maybe prescribing and checking the meds, those kinds of things. Sometimes other practitioners can spend more time with patients than doctors do, and maybe talk more about health promotion and wellness and more holistic care, whereas the doctor maybe has a shorter period of time to come in and be able to quickly decide what's going on and quickly come up with, tests and other interventions. But again, I'm not a clinical person. Encouraging you to do your homework, in that area. One way to do some homework is to become a medical assistant. I don't know if any of you are medical assistants already. There's a demand for medical assistants. Medical assistants at Kaiser make $27, $30 an hour, something like that. And I have one of my former students who she was trying to decide between being a doctor, a nurse practitioner, a nurse midwife. And so she went to work at Kaiser in the OBGYN clinic because she wanted to be in women's health, like some of you do. And she did that for 2 years, working on the front line, like working day in and day out with doctors and nurses and PAs and others. And she ultimately decided to become a nurse practitioner and also a nurse midwife, the combination of those things, because she felt like, given her personality, given the impact she wanted to have, the amount of training that she wanted to go through, and seeing what they did on a day-to-day basis, she felt that that was the best path for her. And she's very happy, doing that. So being a medical assistant on your way to becoming one of these other careers, or as a medical assistant, is something you could think about. We'll talk more about behavioral health in a second. Those of you who are interested in clinical, in microbiology, the hardest to fill position in California of any in any hospital is a clinical lab scientist. These are the people who run all the lab work. Clinical lab scientists also work in like the public health labs, diagnosing COVID and those things. The average age of a clinical lab scientist, believe it or not, is even older than I am. They're like 69, 70 years old. And so they're going to be a huge need for more people in that area. And you can get into that with a 4-year degree plus some internships. Pharmacists are going to be playing an increasingly important role. They already are, and they have been for many years. But pharmacists are now getting more involved in areas like pain management, being involved on primary care teams and monitoring people's hypertension medication and making sure that that's working well, their diabetes medication, those kinds of things. They're more expert consultants. They're doing all the vaccines now, with COVID. All of us have gotten shots from pharmacists probably. So I'm encouraging you to think about pharmacy and talk to pharmacists, though, about what's the day in the life like for them. It can definitely be a stressful job. And it's those of you who are people, you have to think about how much you would want to be involved in the type of interaction with people that pharmacists have and the other things that they have to do versus being some other kind of practitioner. Nursing is by far the largest profession in the country in health and in California as well. Prior to the pandemic, most of the needs were around specialty nursing, like working in the ER, the intensive care area, operating room, those kinds of areas, OBGYN. But now there's a need for nurses overall. And I think that that's a really important area. And you can always start out in nursing. And if you love it, then you become a nurse. You maybe specialize, maybe you don't. Or if it's not necessarily what you do, it's a great stepping stone to other kinds of things. And it's really the place nurses spend the most time, I think, engaging with patients in a caring, thoughtful, really powerful and comforting way. And then, physical therapy, as the population gets older, there'll be increasing needs for people in the physical therapy side of things. Let's not forget oral health, that through dentists and oral hygienists and dental assistants and others, really important area, and making that part of physical health. And interesting, oral health now, they're doing screening for things like hypertension and diabetes and mouth cancers and those kinds of things. So part of prevention as well, big part of prevention is oral health. We've already talked about working with people at the end of their life. So you can see there's a lot of different clinical paths, with physicians being a very important one, but you don't have to be a doctor. You can be in all these other types of roles. And so the key for you is to get exposure, experience, mentorship, networking, those kinds of things to really see which one is the best one for you, and to not be in a hurry. I think one of the things that I notice about students, and increasingly, is that people are in a hurry to pick and in a hurry to go to school. And I can understand that, particularly when you want to make a difference, you want to make some income, you got family pressures on you. But the one thing I can say, and a lot of my colleagues who've been around for a while, is you have a long career ahead of you. And it's really important to choose wisely and to make a well-informed choice, and to take your time and do your homework to find out, which of these is the best way to go. So these are the hot and emerging clinical career paths. Other clinical career paths, though, are in mental health. Oops, sorry here, a little sticking. Behavioral health, as I mentioned, is a combination of substance use disorder, like people who are taking care of folks with substance use issues, either counselors or physicians who are prescribing drugs, or nurse practitioners who work with them. Or you can be a doctor, like a psychiatrist working with mental health, or a psychologist. Those are PhD or MDs. But there are a lot of ways you can provide counseling and mental health services with a master's degree, like a master's in social work, a master's in family therapy. You can be a licensed clinical practitioner. And you can be a nurse practitioner again, a psych nurse practitioner, and a psych registered nurse. Those are increasingly in demand. There's more incentives now, loan repayment, scholarships, things to people to become psych nurse practitioners. People can be also, without having a degree, you can be a peer support specialist, which is a new role it's not new in the country, but in California, it's newly formed and it's newly paid for. It's certified. You get a certification as a peer support specialist, as somebody who has lived experience yourself with mental health issues, as many of us do, or has a family member, as almost all of us have had in some way, with a mental health issue. And so look for more peer support specialist kind of roles. One of my friends a couple of days ago is starting a new job this week as a peer support specialist in Contra Costa County. And then there's a couple of new roles. There's a brand new role called the behavioral health coach that's going to be The state is investing $400 million in creating this role. It will be rolled out in 2024 as a new, brand new like classification. And that's something you don't need a graduate degree to do either. So these are all behavioral health career options. There is no health without mental health. And right now, we are experiencing more mental health issues than ever because of the pandemic and the socio-political situation we've been in, the economic situation we've been in, and there's less stigma around behavioral health as people seeking care, but the access is so limited. 2/3 of the people in California who need mental health treatment don't get the treatment. And it's even more so for adolescents and others. And so please consider behavioral health as a path, either as your main path or in combination with some of the other types of careers that we have. But you don't have to be a clinician. You can be, but there's a lot of hot and emerging health careers. Remember, there are hundreds of health careers that are not clinical careers. And these are some of the ones that are most hot and emerging right now. Public health, which is really the prevention, promotion, protection of the population around not only infectious diseases like COVID-19 and monkeypox, but around chronic disease issues, around violence issues like gun violence and drug abuse and those kinds of things. So public health is really about going upstream. It's really important to take care of people when they are sick, really, really needed. But public health is about going upstream. It's about creating conditions for people to be healthy, to be empowered. It's about social justice. It's about racial equity. It's really about changing systems and policies and institutions and communities to help make it so that people can make healthy choices and be supported and have access to the healthcare and public and the prevention that they really need. Obviously, I'm a little bit passionate about it. I've been in public health for a long time. I came into it because of my passion to increase access to care. My Indian tribe and the community that I grew up in, people did not have access to care, particularly people of color and low-income people. So my focus is on increasing access to care. And you can do that by being a public health professional. I did it in health policy and management. I became a hospital administrator and then a physician group administrator. That means I manage different hospitals and physician groups. I also am a consultant, a management consultant, and I taught health policy and management. I teach health policy and management. So this is an area where I encourage you to think about, even if you want to be in clinical, the management side of things is important. People who are in management make decisions about who gets hired, about which services are provided, about how the community is served, how equity and diversity are prioritized, how resources are allocated, budgets and those kinds of things. And so it's important, and they set the policy. And so encouraging you to think about that. Many people who are doctors, who are nurses, who are nurse practitioners or PAs or pharmacists go into management, and you have that clinical background combined with management skills, which is really great. Or people do like me, they're lay people who go into management and get an MBA or an MPH or both, or a master's in health administration and become leaders in management or policy. So encouraging you to think about that as a path as well. Huge need right now for community health workers and health navigators. Community health workers are people who are from a community that are trusted, that know the community, that know the resources in the community, that know how to support people, meet them where they are. They can work on prevention, like in public health. They can work on behavioral health. They can work on primary care. They can work on navigating within the organization. They can help people with language and all kinds of different issues, getting insurance, knowing how to eat healthy within your cultural and community setting. So community health workers are increasing. The state is putting millions of dollars into increasing the number of community health workers. So this could be an area that would be really beneficial for you to play. Social work is huge. In addition to meeting people's health needs, healthcare needs, we have to meet their social needs, housing, transportation, food, mental health support, All these things are really big. Economic development, getting jobs, social workers help with that, and they help with care coordination. There's a huge need for people to do big data work. So those of you who like data analysis, there's something called big data. Think of all the data going to health, to electronic health records, coming through your watch, coming through your phone, coming through wearables, that you have. Turning that into actionable information to help people is really big. And so we need people like you to do that. And you can make a lot of money doing that and really have an impact, including in areas like digital health and health information technology, which are going to be exploding. One of my former students is now the vice president of digital physical therapy and digital women's health for a company called Hinge Health in the Bay Area. And there's other companies, a lot of other digital health companies now that are really transforming the way health is provided. And the more health is going to be provided in a digital manner than it is in person in the future. So you all need to know that now. The good news is you're digital natives and you're going to be really well prepared to be able to pursue that. But think about that as a career path, as well as being a consultant. When I was your age, I did not know what a consultant was. A consultant is somebody who could be at management or policy, or could be a clinical consultant or a public health consultant. And you provide services outside of an organization, or some places like Kaiser have internal consultants, but you provide consultation to help people with certain expertise, certain types of objective positions, decisions, and maybe having capacity if they don't have it. So I've been a consultant for many years, and people can be consulting on your own. Consulting firms hire people coming out of undergraduate, and they hire people, and some of your graduate students, they hire people coming out of graduate school as well. Really good places to work, and either decide if you like consulting or if you want to do that on your way to becoming something else. And finally, we need more of you to be entrepreneurs. We need more of you to disrupt the status quo, to own your own business, to come up with your own creative solutions. So hopefully you're seeing that there are so many ways, in addition to being a doctor, that you can make a difference in the health field, whether it's as in other clinical roles or whether it's through non-clinical roles. So I'm going to stop for a minute and look at your questions and see if there's any I can answer now, or if there's any other ones you want to
There was
enter.
one question. What was your undergraduate degree at Chico State?
What was my undergraduate degree? Yeah, I went to Chico State. I was really fortunate to do that. They had at the time it was called Community Services, which was a healthcare management undergraduate major. Believe it or not, they had health education, they had healthcare management. And that was really helpful to me because I knew that I wanted to, I'd be a hospital administrator. And so that was great preparation for me. It is now called public health at Chico State, that the department I was in, because we really learned about public health. It was a public health major, but it was just emphasized on serving the community, and in my case, on the management of organizations. So that was my undergraduate degree. And then I went on to I should have said, I got my MBA, Master's in Business Administration and Master's in Public Health. I said I went on record as saying I would never get an MBA because I thought that MBAs were what was wrong with the world. They were corporate, they were arrogant, they were folks that were wanting just to make money, right? But then my mentor said, and it's good to listen to your mentors, that health is a business. I need all of you to hear this. Health is a business, whether you like it or not. It is a complex, pretty brutal business, to be honest with you. And if you really want to support patients and communities and make a change, then it really helps in terms of being able to have management skill to kind of do what you need to do every single day. In my career, it's been helpful to have that MBA in addition to a master in public health. So there's a question related to that. What do you think has been more helpful, an MBA or an MPH? If you have to choose a second degree to go with an MD, I'm looking at your questions here. I think it depends on what you want to do. If you want to be an MD or another clinician and you want to get a public health degree, I think first question is, do you want to be in management and get management skills, business way of thinking, or not in business management, but maybe starting your own business? I have to tell you that running a physician group, which I did for many years, is running a business too. It just happens to be running a business on behalf of doctors. And so Are you doing it because you want to learn to run a business or just have that business background? Or in which case an MBA could really be good, or an MPH in health policy and management. An MPH would give you more about population health and about public health overall, and might prepare you well. A lot of people have MD and MPHs or NPs or PAs and NPHs, which really helps people know that they understand how to take care of patients and they understand how to take care of the population and make change in the population. But some people want to do, even within an MPH, do you want to do management? Do you want to do policy? Maternal child health, like UC Berkeley has a maternal child health MPH program. A lot of people who want to do research, that's a question too. Like if you're a doctor who wants to do a research, like when I was at Harvard, one of my colleagues got his MPH because he wanted to do clinical research, and he got an MPH in biostatistics because he felt he'd be a better researcher if he had that biostatistics training in order to help him do clinical research. So I think the answer is it depends what you want to do and what knowledge, skills, credentials, and connections, would help you the best. Let's see here. What's the difference between a psychologist?
This is a good one, actually.
Yeah.
This is a question that comes up all the time. So I think you have more of a global perspective. How do you pay off your debt for dental school, which is around 200,000, pharmacy, which is around 130, and nursing is 100,000?
Yeah. Well, so first of all, I'm going to give you a really strong opinion that I have that you should not choose a profession or choose a school because of the concern about going into debt or how much it's going to cost for you to have debt. I know in many cultures and many families, like taking on debt is really a big issue. I don't know if you're in a low income situation, and debt is no joke, right? Debt is a big thing. At the same time, if you're going to spend the time and energy to go to school, and you're going to spend money and you're going to be in debt, then you got to make sure it's in the it's in the profession that you really want to be in, and it's in the school that you want to be in. And also many of you will get financing. There's more and more incentives now for particularly those hot and emerging health careers that I identified, like primary care, like behavioral health, like dentistry, nurse practitioners. There's more scholarships that are going to be available for people, especially if you're willing to serve in an underserved community, which I know many of you are willing to do. And so there's going to be a lot more available either on the front end in terms of scholarships, or even right now in California, there are hundreds of millions of dollars for loan repayment for people who go into primary care, who go into psychiatry and into other types of professions, which means that after you finish your training, if you agree to go work in a community health center, for example, or a governmental mental health department or something like that, then you will be able to have some portion of your loans forgiven because you go and work in those needed professions in those needed communities. And so definitely encourage you to look into those programs. There's going to be more and more of that. And whether some of them are governmental programs, some of them are programs operated by health plans like LA Care Health Plan in Los Angeles, for example, Inland Empire Health Plan in the Inland Empire. And so also organizations like Kaiser that are big health plans and health systems, and Sutter Health, and they're going to have loan repayment programs. So for you, I think the key is to choose the right path, make sure it's what you really want to do, and then work hard to find the financing on the front end so that you get scholarships. And yet scholarships don't only come from schools either. They come from things like the Kiwanis Club, the Rotary Club, places that you might not expect that have scholarships for people to become clinical and other professionals, or on the back end that you're going to get your loans repaid. So, I guess, just negotiating. Once your job is to get accepted. So your job is to get accepted, to pick the right profession, get accepted to the school that you want. And once you get accepted, then you begin to negotiate with them, particularly if you can get into more than one school, which you will. about what kind of financial support. You, in a very nice way, you say, I'm excited to come to your school. This is fantastic. And money is important to me. How can you work with me to help me get the resources I need to be able to pay for this, right? And there's a lot of ways going forward that you'll be able to do that. The other thing that happens is lots of times people who go into health professions, they meet another person in that same field, and they're in a relationship of some kind. And so sometimes once you do graduate, you are going to make a lot of money in most of these career paths, especially the ones that require an advanced degree. You're going to make a lot of money. And so once you start getting paid, primary care doctors make $200,000 a year, or more, in many cases, and others make that much money and more. So you're going to be making a lot of money. And if you have a significant other of some kind who also is making that kind of money, even though that sounds like a lot of debt, you're going to be able to afford to pay that and have a good lifestyle as well. Does that answer the question, Jubin?
Yeah, no, I just put a couple of things. There's a HRSA loan program. There's a California loan program that gives you $300,000 for 5 years if you go into an underserved area.
There's National Health Service Corps. National
Yeah.
Health Service Corps is this federal program that not only it's doctors, nurses, other types of professionals. Yep.
Yeah. So I think it's kind of like looking at it from, I think when you're on the other side trying to go in, there's not a lot of opportunities. But once you're done, man, there's people knocking at your door.
Yep.
I have a friend of mine who I'm not going to say where, but he basically was offered a position to go to a place that they really needed his specialty. So he was able to negotiate $250,000
Yep.
to pay off his student loans.
Yep.
And to go there and just sign a contract. I think it was for 3 years. So
yep.
you have a lot of, once you have that, it's kind of like once you have that license and that degree, you have a lot more power than you have when you're outside looking in. And I think, again, like I said, I've used this analogy many times, is to buy a home in California now, it's what average $400,000-$500,000. Most people that make $70,000 to $100,000, they're willing to take that debt. When as a physician or as a dentist, your starting salary is $200,000, and
Right.
you're taking out about maybe that much. So it's kind of like a one-to-one thing. So like I said,
$200,000 for a year, right?
Yeah.
So that you got, then you're going to have a career for 20 to 30 years, right?
Right.
So
I have friends that are doctors that take out $300,000 loan out, and they're done, and they're driving nice cars, buying their own homes, buying rental properties. And so it's kind of like, it's a very different different things when you look at it. So and the other part of it too is I think you hit it on the thing. Yes, you may take out a lot of debt. You should never go into a career because of how much debt you're going to incur,
right.
And how much money you're going to make, right?
Right.
Because you got to wake up every day, and if somebody says, we're going to give you $500,000 a year to, I don't know, do something you don't like, versus
really quick.
you're going to get bored, and something you got to do for 30 years. I mean, that means waking up every day for 30 years. So don't choose it doing that. But yeah.
So I think, and I'm going to go on in my presentation now in a minute here, but I think the core of what I call it your authentic health career. When you're making a well-informed choice about your authentic health career, which means it's the one that aligns your passions, your goals, your lived experience, what's needed in the world, and what you're good at and enjoy, then you're going to want to get up in the morning, as Jubin said. You're going to be excited going to work. It's going to be hard. Health careers are hard. Even when it is your authentic health career, it's still hard. And it's still changing and demanding in those things. But when it's what you're supposed to do, there's nothing like it. That's the priceless part, right? The money part helps too, and the lifestyle and those things. But like I would do what I do, I would do for free. right? And because I love it, it's what I'm supposed to do. And I happen to make a lot of money doing it. And what a great combination, right? To be able to do something you would do for free, but you make a lot of money doing it, and you have a good lifestyle doing it. So you can do it. That's the whole point. So we're going to go on and tell you about how to do that. Before we do that, I'm just going to say that there's a question about biomed. I didn't put a lot of biomedical career paths here, but biopharma careers are definitely booming careers. We're going to have more and more advances in biotechnology and pharmaceuticals and devices in those kinds of areas. And those companies that in those areas are successful. They're very large, successful companies in which you can get paid very well. And then there's a lot of startup companies. You might start your own startup company. My son works for Genentech, which is a big bio and pharma company now. He was a computational biology undergraduate major, and he's doing work in that. He's doing research in that area now and is getting ready to go for his doctorate degree. So within bio and pharma, you can either go the scientific route, like working in research or research and development, clinical trials, something like that. So becoming a scientist, and you can work on scientist teams, as research assistants or coordinators or clinical trial coordinators or managers or those kinds of things. Or there's other in biopharma, there are other aspects ranging, and there's all different types of research, right? All different types of skills. There's wet lab. There's more informatics, bioinformatics, and statistics and things, which is a increasingly growing area. But then there's also areas like product development, product management, marketing, compliance. My brother-in-law worked on reimbursement in biopharma industry. How, when a new drug comes out, how do you get reimbursement for it so that people can use it as much as possible, and so the drug company makes money on doing it. And so there's compliance with regulatory, there's government affairs. My son told me his company was talking about the results of the election. The government affairs people had monitored the results of the election and came back and was telling people, well, here's the impact on our company of what the election and the policies that we think now will come, and the taxes that didn't get passed in our area, and those kind of things. So there's people who are working in that. So I encourage you to look at that as an area within health to potentially pursue. Then there's a brief question about the difference between a psychologist and a clinical psychologist. I don't know that I know the difference. I mean, there's school psychologists. There's a lot of different kinds of psychologists, but a clinical psychologist would be somebody who's really treating patients. And I think becoming a psychologist usually requires a PhD in psychology, which is more of a research-oriented degree, or it requires something called a PsyD, P-S-Y-D, which is more of an applied degree where you learn to be a practitioner in psychology, mainly to take care of patients, those kinds of things. So anyway, let's move on. There's a question about are there things you can get a license for as an undergraduate. As I'm shifting gears here, obviously nursing.
That's what I was going to ask you is you could be licensed without having an undergraduate degree. EMTs are licensed, phlebotomists are licensed. So there's a lot of things you could do. And I think we're doing a talk on the 19th, I believe, about all the various stuff you could do quickly to get clinical experience. And they have basically the timeline. So somebody's going to do a talk on that.
Yeah, and
short careers.
That's great. And you can also, there's licenses for people who are clinical, what are they?
Lab scientists.
Clinical lab scientists. There's people who are
dietitians.
Registered dietitians. There's people who are they're working in the home, like home health aides. You can become a nursing home administrator. You can get a license coming out of undergraduate as somebody who's a nursing home administrator. So there's a lot of things that you can do, but you often don't need a license to do many of these kinds of roles. So don't think of it that you have to have a license. I think if you really want to do a certain path that requires a license, that's great, but you don't have to have a license to make a difference in these areas. So I just want to touch on a couple more things on the major career level, and then we're going to get into how you choose. That these are career paths in the management side. I want you to, again, to think about the management part of it, because you can do well by doing good on the management side. There's going to be a big demand for people in management. You can combine management with clinical, and it is a well remunerated field. I think the health management salaries are very good, and they're hard jobs that require a lot of education, a lot of hard work, a lot of experience, a lot of politics, and those kind of things. But the average salary of a hospital administrator, the CEO, which takes a long time to get to in California, is $800,000 a year. And some people are making over $1 million a year being health management people. A lot of people are making 150, 200, 300,000 being middle management people in organizations like Kaiser, or analysts or consultants or something like that. So, you don't have to be a doctor to do well, or a clinical person. And you can work in either the operational side of things, which is like making sure the patients are getting through the emergency room in a more timely way. We've all had to go through that probably, and hiring the staff and the space and all that, to improving quality, to managing finance, to doing human resources. I like community benefit, which is an important area within health now. Community benefit is the nexus between a healthcare delivery system like Kaiser or Common Spirit or Sutter, or Cedars-Sinai, something like that, and what's going on in the community. Community benefit does needs assessments. What are the community needs in terms of health needs? What are their priority needs? And they provide funding and programs and partnerships and policy change to help support them. There's also policy. I encourage you, all of you, everybody who goes into the health field, whether you are a clinical or non-clinical person, should also become an advocate. And you should develop the skills to become a policy change advocate, because policy drives what happens in the health industry. It drives who gets covered, what gets paid for, whether or not we have access to things like abortions and drugs and birth control and all these kinds of things. It's all policy driven. And so I encourage you to think about that. Okay, I'm going to, it's for my best interest as a clinician or a health organization or the communities I care about. I'm going to be involved in organizing or advocacy or policy making. I love Dr. Joaquin Arambula, who is he's he started out as an emergency room doctor. He's from the Central Valley, like a rural town. I'm blanking on the name right now, but a rural town in the Central Valley outside of Fresno.
Madera.
What's that?
Madera.
Okay, so he's from Madera, and he became an emergency room doctor first. And then he, like many emergency room doctors, end up going, wow, I keep seeing these patients coming in here with gunshot wounds, with car accidents, with being home. So many of the things that can be prevented. And I keep seeing the same patients coming back. I see them not having access to care. They have to use the emergency room. So then they become advocates and policy champions. And so Dr. Arambula is a assembly member from his area. And he has passed all these policies. He's a very powerful chairman of the health budget committee and those things. He just has passed policies around advancing health equity, health for all in California. He passed this policy that I helped create, which was around providing health career opportunity programs. Just put $40 million to college campuses that you're going to get to benefit from to help people pursue health careers. So think about that. This is a person who's an emergency room doctor, but he's like, I need to change policy on a large scale. And think about what you do. If you change policy in California, think about how many millions, that's like 50 million people that benefit from something that you do, right? That's a lot of impact. That's more impact than you will ever have seeing individual patients on your daily schedule. So I'm just encouraging you to think about policy as a career path itself, or in addition to what you're doing. And then
I could say that Mr. Oxendine has actually impacted a lot more healthcare and health delivery than most physicians do in their clinic. Not that it's better; it's just very different.
It's just different, yeah. And so, yeah, so the key for you to think about is like, what kind of impact do you want to have? We're going to have you do that in a couple minutes here. What kind of impact do you want to have? And then think about, okay, can I do that being a clinician? And then what kind of clinician? Is it better to be a doctor, or be a behavioral health person, be a social worker? Or do I want to do it on a large scale in a population health level, preventing or coming up with policies that impact millions of people? Or can you do both? There's a lot of people who do both. And the people who have a clinical background are actually the most credible spokespersons for policy. And then there's people who work on community health. There's people who work on things like community organizing. Many of you, I bet, are community organizers, or they do things like a needs assessment for the population. They evaluate programs. Do they work or not? They write grants to get money for their community-based organizations to be able to serve the population, or they are advocates. So these are some career paths. Someone asked about epidemiology. So epidemiology is the study of the distribution of disease across different population groups, and how diseases are started, how they spread, how we can stop the spread. So think about epidemiology with COVID they're the people who are following the spread of the disease and trying to come up with, okay, how, given the way that it's spreading and who it's spreading to and what the causes are, how do we interrupt that spread? And the same thing is done for cancer. The same thing is done for diabetes and heart disease and other kinds of diseases that are affecting the population. So epidemiologists are people who tend to like to work with data, tend to like to be critical thinkers, to understand like who's getting sick and why, and then what can we do about it, and making recommendations to the management people, the policy people, and the educators about what to do. Epidemiologists work in places like governmental public health departments, the California Department of Public Health, the local health departments. They work at places like Kaiser, looking at all the data that Kaiser has and saying, let's see who might get diabetes and what can we do to help prevent that from happening. They work in biopharma companies. There's a number of places where you can work they work on the COVID response, and those kinds of things. So anyway, these are career paths. And so we wanted you to make sure you understand, like, there are all these other things that you can do. And you can work in a lot of different places. You don't have to work in a hospital. I thought that you had to work in a hospital when I was at your age to really make a difference. You can, but you can work in governmental public health. You can work in medical groups and community-based organizations, community health centers. You can look at the impact that Jubin has on just supporting all of you to do these kinds of things. You can work in academia. You can work in research, global health. Many of you probably are interested in working, globally. So, and then the private sector. So I'm encouraging you over time to narrow your focus on which career paths are the ones that are the most interesting to you, but think more broadly about which areas that you can work in terms of the different types of sectors, because there's a lot of opportunity right now. Amazon and Google and Apple and CVS, like these large companies, are now getting into the health area. So there's going to be a lot of ways that you can go. So now, how do you pick? Let's get into of all these different paths. And we spent a lot of time on the paths because it's important. I should say COVID has also changed a lot of paths for more contact tracers, investigators, telehealth, supply chain, vaccine ambassadors. There's hundreds of millions and billions of dollars still going into COVID mitigation. So I encourage you to think about that. You can combine public health and medicine. This is my friend, Dr. Muntu Davis, who's the health officer for Los Angeles. He was a primary care doctor who then went into public health, and he is having a whole impact on the whole Los Angeles County and the health of that population, as well as on health equity and social justice and those kind of things. But you can combine, I'm encouraging you to combine public health with medicine, with nursing, with PA, with an MBA, social work, those kinds of things. And then we've got to address the things that really impact health are the things that we often don't think about. We think about it because we experience it on a daily basis. But when we think about our career path, like, we don't always think about going into housing, because affordable housing is one of the biggest issues in health, right? And getting people jobs, economic development, education, the things that really impact health are these social determinants of health and access to healthy food and nutrition. So some of you, back to what kind of impact do you want to have? Yes, you can see individual patients, but if people are there because they don't have good nutrition, and you're telling them, hey, you know what, go home and eat better. And if they can't go home and eat better, if they can't afford it, they don't have access to healthy food, they don't know how to cook the foods within their culture, that are healthy, like, well, then they're going to come back to you in a little bit time, right? So we need people to work on these areas as well. So how do you choose which is the right path for you? So this is a book that I've written. I encourage you to consider it. I know it will be helpful to you because it's helped thousands of people that I've worked with, at least the concepts in here, to achieve their authentic health career, to choose. It doesn't talk you out of being a doctor. It actually helps you make a better informed choice and know how to decide which is the right path for you. You can get it on Amazon for the price of going to a movie and a slice of pizza. So I encourage you to check it out. I know it'll be helpful to you. It's not an academic book. It's a practical book with lots of exercises that you can use to help you decide which is the right path for you and how you want to get there. So let's talk about some of the concepts. And I do this because I'm a public health person. So my prevention now is preventing you from making a choice that isn't the best for you. I want you to decide the first time around what works for you. So your authentic health career is the one that suits your unique talents, your passions, your goals, and your lived experience. This is your authentic, meaning you. There's only one of you in the whole universe. And actually, when you have to write your application and go to interviews for medical school, my friends who are the medical school people say, Jeff, I can tell that people aren't writing in their authentic voice, or I can tell they're not interviewing in their authentic voice, that I don't know it's their authentic health career path, because you can say what your parents want you to do, what you think you want to do, what people are putting pressure on you to do. But if it's not who you really are, it comes across, and you may not get into the school degree and program that you're looking for. So choose the one that really is who you are. And that's what it's all about here. It's your life. It's no one else's. And somehow your heart and intuition already know what it is that you want to become. So if you follow your heart and intuition, and then you do the work that we're doing today on saying, okay, here's what I'm passionate about. Here's what I think I want to do. But now let me really learn about the career options that are out there. And let me do the work to find out what it's really like, getting exposure and experience and talking to people. Then you can make a well-informed choice, but choose the path that's best for you. It's your life. You've got to live your life. You want to have the impact in the life that you want. You're the CEO of your own life. And it's not just a fluffy thing. Follow your heart and intuition. Going to medical school will cost you your 20s and your early 30s, because it's going to be you got to finish undergrad. You've got to get into medical school. Sometimes more people are taking gap years. They're doing post-bacs. You got to finish medical school. You got to do residency, a fellowship. Pretty soon you're in your early 30s and your 20s are behind you. You worked really hard in your 20s, which is great if you're doing what you authentically want to do and what you really want to do. But if not, that's a pretty big decade to give up. And we already talked about the issues with debt. Graduate schools are looking for fit. And so you've got to convince them that you're a good fit for their school degree and program and for the profession that you want to go in. And so you really want to work at it and make sure that when you put it forward, it really is your best foot about who you are, what you want to do. And I can tell you that, and back to Jubin's example of, you can be paid a lot of money, but if you're not happy and if you're not healthy, it doesn't do you a lot of good. In my own case, I was teaching at Harvard. I was working at Brigham and Women's Hospital, prestigious hospital. On paper, I had a great status job. Was making a lot of money, beautiful children at home. And I was grumbling all the way to work and grumbling all the way home, because it wasn't, at that point, it wasn't what my authentic health career was calling me. I was afraid to choose it because I had kids. I didn't want to give up the job security, the income, and the status. And this has been my identity for 20 years, being a health executive. I was finally at the top of my game. And I'm like, but this isn't really what I want to do. And my body was telling me, I went to the doctor, who looked at me and he goes, wow, you look really depressed. And I went, hey, I'm here for a sore throat. And he's like, yeah, but you look really depressed and sad. Like my body was beginning to tell me, well, if you're not going to choose, I'm going to choose for you, which you don't want to have, right? Your health is, if you don't have your health, you don't have anything. So the way you could, what more about me in a second. So you can choose.
And
Go ahead.
The only thing that I would add to is that from that job that you had in Boston to here, you took a big cut, but you were much happier, right?
Yeah, I'm going to talk about that in a second. Yeah. So what happened is that I know I chose my authentic health career path, right? Because my path was to help you, and it was to help students, and it was to go to work on public health issues and health equity and diversity and workforce. And and to teach. And I was being a health executive, I was managing and doing all those things. But so what I found was that if you can find the alignment between what the health and employers need, like that's why we spend a lot of time on what are the jobs of the future, right? And then what you can get paid for, or what you can disrupt and change. If you can align that with your passions, your values and goals, and what you're good at and enjoy doing, if you can find the alignment of those things, and you've got to do the work to do that, and my book has a lot of exercises to help you, then you can have the things in the middle. So back to my point, and Jubin's point was, I took a 70% salary cut when my third child was on the way. My wife was not working in the industry. She was working at home. And I moved my family across the country from Boston to Berkeley so that I could be at UC Berkeley so I could pursue my authentic health career. And I did. And it was, besides marrying my wife, it was the best choice that I've made. It was priceless, because even though I took a big hit, I had people reminding me all the time, hey, Jeff, gosh, you could have made a lot more money if you just stayed at Harvard, if you just stayed at being a health executive. I was like, yeah, but I was so much more happy. I was so much more fulfilled. I could have such a bigger impact than I was before. And over time, to be honest with you, I've made up not all the money that I would have made, but I make enough money to have a great lifestyle. And I was there for my family. I was able to, as a health executive, I was not going to be able to be there for my family the way that I was with the autonomy of being in a health executive position. So that was one of my values, is to be a good parent and to be present and to coach baseball and to go to the dance recitals and to do all those things, which I wouldn't have been able to do if I was just a busy, health executive. So sometimes we're just surviving, right? Sometimes we're just getting through organic chemistry. We're dealing with COVID. We're dealing with health issues and income challenges, but sometimes we're searching. It took me probably 5 years to make that choice, to make the shift. And sometimes it all comes together where you are living your authentic health career and you have the financial rewards that you want. You have the satisfaction. You can do it. If I can do it, you can certainly do it. And I've had thousands of students that I've worked with that are definitely doing it. So this is how you can do it. And just be bold. I encourage you to be bold, because you know what? If you're bold, if you're doing what you're really supposed to do, mighty forces will come to your aid to be successful. I know it. They have for me, and they do every day. And you're exactly where you're supposed to be, whether you know exactly what you want to do now, whether you're more confused than ever, whether you're like, hey, I want to go out Saturday afternoon and go to the beach and stop hearing this talk, whatever it is, you're exactly where you're supposed to be. You have options. The key is to move forward with the belief that you can discover and achieve your authentic health career. So now let's talk a little bit how you do that. I'm going to show you this framework, and then I'm going to give you an exercise to do. So these are 9 steps that you can take to get from where you are to where you want to be and having your authentic health career, choosing it and succeeding in it. And the first is to get as much exposure to what's possible. That's why we spent a lot of time. We spent the first hour talking about what are the career options and how do you choose, because you need to know what's possible. I grew up in a place where you didn't know what was possible, and I had people who didn't make good choices. Somebody the other day told me that there's a movie where they talk about, I didn't make good choices because I didn't have good choices to make, right? He didn't know any better. So the key is getting exposure to what is possible. That's job number 1 for you. Good job for being here on a Saturday to get exposure today. Number 2 is self-assessment and discovery. That's the bottom of the triangle. What are you good at and really enjoy? What do you want to do? What would you get excited about getting up to work every day to do? What are your values, passions, and goals and your lived experience, right? So your self-assessment, and how does that relate to what the career options are? And then you've got to get practical experience. There's nothing like having internships and part-time jobs and volunteering and shadowing and those things to help you go, wow, okay, I thought I wanted to do that. But everybody I know who does an internship in Health Career Connection, I have 4,600 people who've done a Health Career Connection internship. A lot of them say, hey, I discovered what I want to do, or I discovered what I don't want to do, which is also really helpful. And you have a track record to help get your job with practical experience. So getting experience, particularly before you go to these grad health profession schools, is really important. And then you got to choose and pursue a direction. We're going to work on yours in just a minute. And that means you've got to pick, I'm going to be a doctor, or I'm going to be a doctor with an MPH in biostatistics or epidemiology, or I'm going to be a nurse practitioner. It's choosing a direction and then having a plan on how you're going to get there and a timeline. And you notice your educational preparation isn't the first thing. Educational preparation comes after you've chosen your direction. I meet a lot of students. I say, hey, what's your health career direction? They'll say, oh, I'm getting an MPH. I said, well, what are you getting an MPH in? I don't know. I'm getting an MPH. I love public health. Well, that's really great. But if you want to be and I want you to get an MPH, but I want you to get an MPH because you want to be a health executive, or because you want to be a community health educator, or you want to be an epidemiologist. And then you get an MPH that aligns with that career path, not with something that isn't going to be helpful to you. And then you've got to package yourself. You've got to have a good LinkedIn, resume, cover letter, interview skills. You've got to package yourself so people can see how awesome that you are. But packaging yourself isn't enough if you don't have a good network, because it's either network or not work. You really need to be able to have a personal and professional network, or be a networker, which maybe isn't comfortable for everybody. It wasn't for me, but it is now. It's a skill that you can develop. And Jubin is the number one networker, right? And so you want to have a good support network to get you where you are. And then you got to believe in yourself. You've got to believe that, oh my gosh, can I take a 70% salary cut when my third child's on the way and go for it? Yes, I can, right? Hard, scary, second guessing, but believe in yourself. And then finally, can I tell my parents, for example, could you tell your parents that, I don't really want to be a doctor. I want to be a health executive, instead. That might be not so easy, right? And finally, you'll make mistakes, as everybody does, and you'll learn from them, right? And you can adjust. I'm on my third or fourth version of my authentic health career. So here's my point, is that these are 9 things that you can do that can help you make a well-informed choice, and can, through the networking, through your packaging, through believing in yourself, to be able to get there and succeeding, and to have other people choose you to be able to do it. Each chapter of my book is about one of these different areas and gives you exercises and skills and tips on how to do it. I encourage you to say, okay, what do I need right now? Do I need more exposure? Do I need more experience? Do I need to strengthen my network? Do I need to work on my belief and courage, which most of us do? Do I need to get my LinkedIn profile to be better? My resume to be stronger? So these are practical things that you can do to be able to make progress in your authentic health career. I'm going to skip these kinds of things here and kind of go into now a little exercise for you. Well, first of all, there's internships, because in the interest of time here, one thing you can do to get that exposure, experience, the mentorship, the networking, the skill building, is to do internships, to do paid summer internships. Here are some internship programs. I'm going to talk about Health Career Connection in just a minute. HCC is the nonprofit that I've founded and have run for 32 years. It's about undergraduate students and recent graduates up to 2 to 3 years getting a paid internship experience in a health organization. They're not clinical experiences, but they are often around the clinical processes, and you meet clinical people and you work on clinical projects, but you're not delivering care. But a lot of them are public health oriented, health management, health policy oriented kinds of things. There's something called the Center for Disease Control Lewis internships, which are all across the country. The applications are opening soon, if not open already. They have them in California at UCLA, for example, where you get training and education in addition to doing an internship. There's something, for those of you who are sophomores and freshmen, there's something called the Summer Health Professions Education Program that are there. It's a national program through the American Association of Medical Colleges. And you can apply to those programs. There's also 12 of those in the country that you can pursue, where you get more of a clinical type of experience and preparation. And then there's some new money from the Office of Healthcare Access and Information. I remember I mentioned the Dr. Arambula policy change. So there are health professions pathway programs now at many CSUs and UCs, which they're going to be having a lot of money to provide paid internships. This includes Fresno State. This includes UC San Diego, Cal State Dominguez Hills. It includes, I don't have the whole list, but if you look at the Office of Healthcare Access and Information, HCI, and you look at Health Professions Pathway Programs grantees, you will see who got money, and maybe that's your school, or maybe they'll have an outreach program that you can go for. UC Davis.
Can you say it again?
Well.
I could pull it up. What is it
so,
called? The Office
so Jubin, if you go to the Healthcare Access and Information in California, HCI, and you look at Health Professions Pathways Programs, They just made the awards. It just has a list. It's a PDF with a list of the grantees.
That's
They don't have
that's
applications
the old
available.
Oshpit, right?
It's the old Oshped. So you would be able to see which of these different schools are going to have money to provide internships. And also they're going to be offering programs that you might be able to participate in around health career exposure and preparation. So you can look at that. I'm going to ask you to do a little exercise before we go on how to create the life that you want by creating the work that you love. I'm going to ask you to write down the answers to these questions. This is going to take about 5 minutes. And I'm encouraging you to do this on your own afterwards. But I want you to identify your answers to the following questions. Write it down or type it into your phone or your computer. Don't just think about it in your head. Because I found that if you can come to the answer these questions, you can begin to get a pretty good clarity on what it is that you want to do. What is your authentic health career direction? If you can't answer them, it's okay. Then you can get more exposure and experience to find out how to answer these questions more. So having you write them down, the first question is, if you're living your authentic health career, what population or populations do you want to be able to be serving? So would you be serving the people in your hometown? Would you be serving people that are elderly? Would you be serving kids? Would you be serving people with diabetes or people who have a certain other health condition? Maybe it's a developing country, population. Maybe it's rich people. Like, who are you serving, right? If you're living your authentic health career, you're doing what you want to do. Which population or populations, are you serving? Maybe it's the Latino population or the African American population. So which population or populations would you be working on that you'd be really exciting every day to be supporting? The next question is, what health issue or determinant of health would you be working on? Are you working on diabetes reduction? Are you working on cancer prevention? Are you working on a determinant of health, like being able to improve housing, affordable housing, or education? Are you working on health education? Remember, I was working on access to care. People having health coverage and access to care. I work on workforce development now. Maybe it's violence prevention. Maybe it's reproductive health rights. But what health issue or determinant of health are you working on? And it could connect to the population you're serving. Maybe it's teen pregnancies or something like that, or it's healthy aging for an older population. Which type of health organization are you working in? Are you working in a hospital? Are you working in a community health center, a health department, a behavioral health organization, a community-based organization? Maybe you're working in a medical school. So which type of organization are you working in? So you could say, well, okay, if I'm serving the Latino population, I'm working on diabetes prevention, and access to care. I'm doing it in a community health center that's located in a Latino community, something like that. And then which role or function are you playing? Are you being a doctor? Are you being a PA? Are you being a nurse practitioner? Or are you being a health executive, a health policy, a community organizer, a community health worker, pharmacist? So what role or function are you playing? And you can see yourself, all right, I'm working with these populations. I'm being a health executive, or I'm being a PA, whatever it is. And it's okay to have more than one answer to these, by the way. Then you can just keep getting more exposure and experience to help figure out which is the right one. And then how close to the patient or the community do you want to be? Are you somebody who wants to see individual patients all day long, every day? Or you see patients 2 days a week and you work on health policy 2 days a week and you teach another day a week? Or are you somebody who's sitting in Washington, D.C., making health policy issues for hundreds of millions of people? There's no right or wrong answer. And then maybe you're like the CEO of the hospital I worked with at Brigham and Women's, who he was working in the hospital on a daily basis. And once a week, he would go to Washington, D.C. to advocate for things that were in the best interest of our hospital. And then what impact do you want to have ultimately? And what's your definition of success? You're going to be working really hard throughout your life. And unless you choose to spend more time with your family, which you might do, you're going to spend more time at work than you are with your personal lives and your family. So good to work backwards from the end and say, okay, when I'm 83 years old and I've, what impact have I had? And impact is not easy when you're in your early 20s or your teens to decide, but maybe it is easy. It's like, hey, I want to reduce violence, gun violence in my community. I want to care for sick people at the time of their greatest need. I want to be able to empower people like mine, empower you to live your authentic, health career on a large scale. I want to be able to do that. And then what's your definition of success? Let's be clear. How much money do you want to make or do you need? What kind of a lifestyle do you want to have? How much time do you want to have for other things besides your job? Is it important to spend time with your family and your children, with your children when they're young? What's important? How about your spiritual goals, fulfilling any kind of spiritual goals that you have? So what is your definition of success? And what I found is if you can answer these questions, you can say, an example could be, I want to work with the Native American, the Lumbee Indian population that's in rural North Carolina, my Indian tribe. I want to work on reducing prescription med abuse, but I also want to work on empowering young people from our community to become health professionals. I want to work in a community health center where I can be close to the population each day. I can see people, engage with the community, and improve their health as a health executive, but at the same time, and as an advocate, but at the same time, I'm going to work on policy change at the county and at the state level, because I know I need to be an advocate for policy change. The impact I want to have is reduce the rate of prescription drug abuse in the community, as well as I want to get hundreds of Lumbee students to get into health careers and to come back and serve their community. And I want to do that as my definition of success, plus making enough money, having enough life, enough money and enough flexibility to travel, to have a good life for my children, and to fulfill my spiritual goals. So you can see that if you can answer these questions, and if we had more time, I would have you tell me your answers and we'd have some discussion about it. But you can see if you can answer these questions, you can begin to carve out what is my authentic health career path. And you might have 2 or 3 examples of these, and then you can go about getting more exposure, more experience, more mentorship and networking to be able to really figure out which is the right path, and then choose a graduate program and choose a degree that will help you to get there, right? If you say, hey, I want to improve population health on an upstream level, I want to prevent people, from getting diabetes by giving them access to healthy new food and nutrition. Well, that's not being a doctor, right? Being a doctor is taking care of sick people when they come in, each day, and giving them some drugs and giving them some next steps and supporting them, referring them. But you're not going to spend your day preventing people from getting sick. You're going to be taking care of sick people. So you want to see, is it congruent what you want to do with the professional path that you're choosing? All right. So speaking of choosing, it's okay if you don't know yet. You know what? No pressure. You're young. You've got time. Don't be in a hurry. Take your time. Focus on making good choices about your next steps. Get more exposure experience. Use the framework. Pay the bills. Keep the faith. Just keep going. You know what? After some of the most confusing periods of time I had are when I would all of a sudden have a breakthrough that would have a lot of clarity and help me go forward. So keep going. And there's things you can do now. And I'm just going to touch back on the Health Career Connection internships. There's a California Medical Scholars Program, which is a new program for community college students. There are new California Medical Scholars Program regional hubs of health career opportunity at these different medical schools. And these are going to be ways, if you're in community college, that you can get support to pursue getting into medical school. A number of kinds of really good programs to do that. So I encourage you to look at that now. We're going to talk about health. You can network with me. I'm Oxendine at Berkeley .edu. Be patient with my email response time. Very patient because I got a lot going on and I can't be as responsive as I would like, but I'd be happy to do an informational interview with you. Then I encourage you to pursue Health Career Connection. So HCC Health Career Connection is a national nonprofit. We support undergraduate students, recent graduates, and our alumni to choose and successfully pursue your authentic health career and to get into graduate school and to get jobs. 60 to 70% of the people get a job or extended internship through HCC, and others, 82%, graduate from graduate school within 10 years of completing HCC, including doctors and PhDs and those kinds of things. We're at healthcareers.org. We are, let's see here. Let me get to the point here. We provide internships in hospitals and community health centers and health plans, local health departments, biopharmaceutical companies. For those of you that are interested in that, we have some really great biopharmaceutical companies that we work with. We have behavioral health internships in a big time way. We're really promoting behavioral health career paths. And what we do is we give you hands-on experience working in an internship program in a structured way. You get assigned a mentor, and HCC mentor staff mentor you. We build community. You get to do this with other people in your regions and across the country who become your colleagues not only this summer, but beyond. And then we have lots of professional career leadership development workshops around things like advocacy and cultural competency and health equity. And we do graduate school workshops, and we connect you to our graduate school partners, which are UCSF and Stanford and UC Berkeley School of Public Health and Harvard School of Public Health and North Carolina and Columbia. We connect you to those folks who want you to come to their schools. And we have a Health Equity Scholars Program, which is a program, part-time program. Our internships are full-time in the summer for 10 weeks. Our Health Equity Scholars Program is 20 hours a week. And it's for 8 weeks, and you still get all that training that I talked about. Plus you do a team-based consulting project. It's just not placed in an organization. And these are some of our partners I mentioned to you. So the deadline is December the 5th, which is almost a month. You got some time, but you're going to have to start working on it. The good thing to do after you have Thanksgiving turkey, you're sitting around, your belly's full, you're tired of watching football and talking to your relatives, and I'm being extreme here. You can sit down and work on your application. And then we have interviews in early January. We try to match people in by April. So it's a great program. We've had 4,600 people do it who are doctors, who are nurses, who are pharmacists, who are public health leaders and health executives and behavioral health clinicians. So I encourage you to apply to HCC. And I know if you go confidently in the direction of your authentic health career, you're going to be successful. And just a couple of examples. This is Dr. Evita Limon Rocha. She's an MD and an MPH. So really combining the two. She is a psychiatrist for children and for adolescents, which are very rare, especially a bilingual one. She's serving the community where she's from, the Inland Empire. And she's also a devoted mother. So she's combining her life and her career. And guess what? She's an advocate. She's on the board of the advocacy organization where she did her HCC internship. And finally, these folks here, Brittany Giles Cantrell, I just saw her 2 days ago in Boston. She's the African-American woman on the far left to me. She's the head of the Beaumont Foundation's Health Equity and Health Workforce Initiatives. And so in any case, I show you these pictures because they started out exactly in the same situation that you did. They pursued their authentic health career. They followed all the things that we just talked about. And you can see they're smiling because they're not only got their degrees, but they are succeeding in their authentic health career. And you will too. So we'll be inserting your picture there. I'll be on one side. Jubin will be on the other side. We'll be giving you a high five. So that's a lot today. Thank you for doing this on a Saturday. Jubin, I'm happy to answer maybe just a couple more questions if you want. Thank you all for being here today.
There was another one. What's the difference between a BA and a BS in public health?
I don't know that matters so much, to be honest with you. It usually is like what your school happens to call it, or what its particular school happens to call it. Maybe there's some technical things that make it more of a BS. But in the end, it's in public health. It may matter more in other areas. But I think if the issue is if you have an undergraduate degree in public health, then people will recognize that. Some places might care if it's one way or the other, but I think it might just depend on which school that the program is in and maybe some of the coursework. But I wouldn't get hung up on that.
And this person is also worried about getting into an MPH program, and you could be any degree to get into an MPH program,
Correct.
right?
Yeah. Yes. Oh, yeah. In fact, most people that are in an MPH program don't have an undergraduate degree in public health. They come from all other fields of study. It's more being able to articulate the things we've talked about. What do you want to do in public health? What kind of impact do you want to have on which population, on which issues? And then why are you getting a certain degree in public health? Is those are the kind of things that really matter. And then choosing which of the paths, is it health policy and management or epidemiology or global health or something like that.
The other question is, what's the difference between medical anthropology and public health?
Well, public health, has a large range of disciplines. So public health has all the things like epidemiology, community health, nutrition. And public health is really about promoting the health of populations, and it's about protecting and preventing the disease, right? And medical anthropology, and I'm not a medical anthropologist, but it's more about the study of anthropology itself, apply and how culture affects health beliefs and health organizations. Medical anthropology also looks at how health organizations function, but it's really looking at it from the lens of anthropology. And whereas public health is looking at it from a more multifaceted way, with anthropology being an important part of it. Actually, to be honest with you, I really value medical anthropology. I think it's really important to understanding how individuals and how institutions function. But public health would go much, you would get in public health, you take classes in epidemiology, you take classes in health management, you take classes in health promotion and in a number of other areas to really make sure you're understanding what is it that influences the public's health and population health, and what are skills and competencies are needed to address it. Whereas anthropology wouldn't necessarily give you those things.
This is another one. Many community college students worry about choosing the right path for undergraduate major. Do you mind sharing your insight?
Well, I think that, you know, choosing a major can be a process of trial and error and exposure and experience and those kinds of things. I understand there is pressure, and there's certain schools have more pressure than others about how to choose the right major for you. I think I would go with things that you are interested in and care about, that are courses where you feel like that's kind of like the triangle that I have. Like, what are you good at and enjoy doing? What do you see fits with your values, your passions, your goals? What do you see is needed in the world? And trying to find alignment between those things is important. Or at least, what are you good at and enjoy? What are you curious about? Like, what gets you excited to study? What can you see yourself doing? But maybe, less about what you see yourself doing ultimately, because you may or may not know that yet, I guess. But what excites you? What do you want to study? What makes you want to, and what are you good at, so that you can be successful along the way? There are majors you might consider about, if you want to go into a certain health profession, you might have to have certain prerequisites. You might have to make sure you're taking certain courses, and maybe if you have to take enough of those, then you can, they'll all add, then you want to choose a certain major. So I guess I would have an eye towards what you want to do, combined with, if you don't know what you want to do yet, what do you enjoy? What are you good at? What would make you enjoy what you're doing? What classes do you like? Those kind of things.
Yeah, and I think I put in there, I don't want to get too Socratic, but an unexamined life is not worth living. Doing something that makes you happy and that you could do well in. Now,
Right.
I mean, a lot of people say, well, engineering, well, engineering is very tough. And if that's what you want to do, do it. But, again, it's about being happy and and what your major is your major is a piece of paper or career or path is something that takes a lifetime to do. I mean, I think even with you, Mr. Oxendine, you're still on your path.
I
You're not
still am
there
on my
yet.
path. Yeah.
So, yeah, and so the other part of it too is that different programs have different things. And so if you want to, but most programs now will want you to major in, things that make you happy, and then they have a certain requirements or recommendations. So yeah, so definitely looking at that. Somebody wanted to ask about, so there's a lot of questions about biomedical, bio research, and all these different things. Next week, we're going to have the NIH director for training programs.
Awesome.
So if you guys have research stuff, like come and ask her, because she not only is a researcher herself, but she oversees all the programs from community college to undergraduate to postgraduate to medical students. So, I mean, she's like the research person, and she has
Yeah.
a lot of those things that. So I'm gonna not ask those questions.
Yeah.
I think a lot of people are asking about what major can you do to do health management and policy change.
Yeah. And I just have, maybe I'll have my last question because I do have to go to another commitment. So I would either, and I'm glad folks are interested in health management and policy change. You can either be like me and maybe your school has an undergraduate major that's in health management or health policy, or it could be a public health undergraduate course, set of courses, and taking a class in health policy and taking one in health management or health economics or organizational behavior. You could take classes in the business school as well. You could be a business major. A business major is a fine major for health management or health policy, or you could be a public policy or political science undergraduate major. You could be, some health sciences programs have a management track or some management courses or something like that. And so, or you could be nursing, you could be social work. But then what you want to do is combine that with some kind of experiences and coursework and internships and things that might be going in the direction of health management. I think it's important to take, regardless of your major, and maybe you have to be a certain major to take these courses. I think having a course in the healthcare industry, like how it functions, is really like the U.S. health system or something like that. And understanding like who are the players, what's the role of a health plan versus a hospital versus a clinic versus the government, and what kinds of insurance are there, and what do they pay for and what do they not pay for, like learning to follow the dollar, like, because how the private and public dollars are paid for influences how the system works and how the players are, and understanding how doctors work and what their role is in the system. So taking a course in the U.S. health system, taking a class in health policy, trying to see if you can take a health management class, a health economics class, and then any classes related to managing people or leadership classes would be good too. Some kind of leadership class, and sometimes those are in a business school, sometimes they're in a public health, sometimes they're in education or engineering or something like that. I think those are things I would take as a foundation, in addition to getting some experience. And as I said, business is also a good undergraduate major for health management. Also, maybe something like data science. I would say that that health management is becoming more data driven, and people who go into the field have to understand. You may not have to be the ones who crunches the numbers, but you have to understand how the numbers were derived and how to think critically about them. So something like a data science major or minor could also be helpful.
All right.
So thank you all so much. And Jubin, thank you so much.
Thank you again
for the
for
opportunity.
coming.
Yeah, thank you all for coming. And
Sorry
please,
for holding you longer.
Oh, no, I wanted to be here. I took longer. So please.